Hello everyone, my name is Antonella Aguirre and today I will talk to you about the therapeutic clearance of amyloid by antibodies to serum amyloid B component. The definition. Amyloid AA is an extracellular deposited insoluble fibrillar protein, highly resistant to proteolytic degradation. Such deposition is common for a group of disease known as amyloidosis. The antibody is a useful aid for the identification and classification of AA amyloidosis. Amyloid progressively causes the slow and gradual failure of the affected organ.
Amyloidosis is the term used to describe a group of diseases in which deposits of an abnormal protein called amyloid form in tissues and organs throughout the body. Proteins are important molecules involved in almost every structure and function within our cells. They are made up of chains of smaller units called amino acids, which fold themselves into three-dimensional structures. Folding allows the protein to work properly and interact with other molecules. In amyloidosis, proteins are made in the normal way, but when they are released from the cell, they open up again. These abnormally folded proteins collect together in long chains or fibrils. The deposits they form are called amyloid. Amyloid fibrils are difficult to break down, and as they accumulate, they start to cause damage. Eventually, the build-up of amyloid fibrils stops the affected tissue from working properly. AL amyloidosis is caused by a bone marrow disorder. The bone marrow produces blood cells, including plasma cells, a type of white blood cell that forms part of the immune system. Plasma cells make antibodies to help fight infection. Each antibody is made up of 4 protein chains, 2 heavy chains and 2 light chains, which attach to each other to form the complete antibody. In AL amyloidosis, the abnormal protein that builds up and causes problems is the antibody light chain, hence the name AL amyloidosis. Instead of attaching to heavy chains, the abnormal light chains open up and bind to other abnormal light chains to form amyloid fibrils. These gradually build up over time. Amyloid light chain fibrils can occur almost anywhere in the body, but the organs most commonly affected include the kidneys, the heart, liver, spleen, nerves, and the digestive system. Treatment for AL amyloidosis involves chemotherapy, steroids, high-dose therapy, and stem cell transplant, and other drugs. Treatment is aimed at reducing the plasma cells to stop further amyloid light chains being made that would otherwise build up in tissues and organs. It also gives the body a chance to break down existing deposits naturally. However, on its own, this process can take many months or years. New treatments which break down the amyloid deposits more quickly are currently being tested in AL amyloidosis. The hope is that they can reduce symptoms and restore function quickly, and in doing so, improve quality of life for patients.
Exists a classification of amyloidosis: a systemic and generalized amyloidosis, primary, secondary amyloidosis associated, and heredofamilial, and localized amyloidosis. The application in medicine. Current treatment consists of support or replacement of failing organs and measures to reduce the abundance of the amyloid fibril precursor protein. 1.2. A sufficient reduction of precursor supply arrests the accumulation of amyloid and can reduce morbidity and mortality. However, amyloid regression is very slow and often doesn't occur at all, in contrast to the usually swift clearance of other extracellular debris and efficient tissue remodeling. For example, after a trauma. At least 65% of cases of systemic amyloidosis in the United States and Western Europe are or the immunoglobulin light chains ALE type that is caused by B cell or plasma cell decrease. Here we can observe some pictures about amyloidosis in the patients.
Amyloidosis occurs when abnormal proteins called amyloids build up and form deposits. The deposits can collect in organs such as the kidney and heart. This can cause the organs to become stiff and unable to work the way they should. There are three main types of amyloidosis. Primary, with no known cause. Secondary, caused by another disease, including some types of cancer. Familial, passed down through genes. Symptoms can vary, depending upon which organs are affected. Treatment depends on the type of amyloidosis you have. The goal is to help with symptoms and limit the production of proteins. If another disease is the cause, it needs to be treated.
The pros. Some varieties of amyloidosis occur in association with other disease. These types may improve with treatment of the underlying disease. Your doctor may suggest medication to reduce amyloid production and control symptoms. Some people can benefit from organ or stem cell transplants and the dialysis. The cons. Some varieties of amyloidosis occur in association with other disease. These types may improve with treatment of the underlying disease. Treatments may include a chemotherapy similar to that used to fight cancer, skin changes such as easy brightening or thickening, and purple spots around the eyes. Irregular heartbeat, difficulty to swallow, and amyloidosis is more common in men, and people of African descent appear to be at higher risk of carrying a genetic mutation associated with a type of amyloidosis that can damage the heart. Issue applied in Ecuador. Register patients with dermatological diagnosis in the area of the dermatology specialty of the University Hospital of Guayaquil period 2040-2050. Inclusion and exclusion criteria were applied. We have an incidence in the University Hospital of Guayaquil of only 14 patients. 53% taking into account a total annual patients consultation of 75 patients. 48 of our patients corresponding to 64% of patients between 80 and 41 years old. Female sex predominate 73 patients that according is 97% time of evolution of lesions less 1 year, 50 patients, 67% type of skin lesions with the highest percentage is lesion. 61 patients that occur is 81%. Now we have another pin that we can demonstrate the damage of the amyloidosis. What organs can it affect? Well, protein in the urine, renal failure, carpal tunnel syndrome, glaucoma, dark flutters, abdominal blood, LI swelling, irregular heartbeat, heart failure, nausea, vomiting, loss of appetite, diarrhea, constipation, wasting of muscle tissues. We have nail lesions, periorbital purpura, macroglossia, submandibular swelling, alopecia, and jugular vein distension, and shoulder pad.
Imaging is starting to play an important role now and is emerging, particularly imaging with MRI, that turn out to be a rather sensitive way to detect amyloid involvement and also to follow the amyloid deposit through therapy. This is particularly important now because, as Dr. Palladini will explain in his part of this afternoon session, new drugs are appearing now that can target the amyloid deposit. This is passive immunotherapy, and we have at least 3 antibodies that are under test in the clinic. One is NEOD-001, that was the first one to be exploited. The second one is being proposed by the London group that is targeting SAP. Is a combined, actually, treatment, previous treatment with a small molecule that clears SAP from the circulation, followed by the antibody that target the residual SAP in the amyloid deposit, rapidly accelerating the removal of the amyloid deposit. And the third antibody has been developed by Dr. Solomon and by our colleague at Columbia University, that also has been reported in several meetings to be rather promising. So the aim of this antibody is to accelerate the recovery of organ dysfunction, particularly the heart, with the hope to further improve the outlook of these patients.
And in the conclusion, to draw the conclusion, one can say that amyloidosis with very heterogeneous manifestation that affects several organs, mainly kidneys, heart, and liver, can be hereditary or acquired, localized or systemic, the latter being the most frequent presentation. Diagnosis and treatment depend on pathological diagnosis and immunohistochemical identification of the type of amyloid deposit. All in all, patients with a new diagnosis of systemic amyloidosis require a rapid and safe removal of amyloid deposits to maintain or restore the function of vital organs. So, that the measures to reduce the production of amyloid fibril precursor protein and thus stop the amyloid building up can be effective. And to finish, we have the bibliography. Thank you so much.